have an update for you on the state of Ebola preparedness in Alabama.
Sherry, the chief health officer and Governor Robert Bentley weighed in on what they are planning and how many cases they are monitoring right now. WIET 42 News reporter Mike McClanahan joins us live from Montgomery with the latest on the Ebola plan of action here in Alabama.
State health officers are monitoring 2 people in Alabama for signs of Ebola. That's down from 3 people on Wednesday. They are considered low risk, but the chief state health officer says that anyone at any risk is going to get checked out. That being said, he says he will not institute a blanket quarantine for at-risk people who aren't showing symptoms.
The Alabama Department of Public Health receives nightly updates from the CDC about all passengers traveling from West Africa to Alabama. 100% of that air traffic is now routed through 5 airports. People are screened and put into categories of low risk, some risk, or high risk. The state health department gets that information, contacts those passengers, and monitors their temperatures and travel plans for the next 21 days.
We're going to see 2 or 3 every week or 2 weeks that we need to follow. Is it possible that one of those could develop Ebola? It is. I think it is less likely we're going to have one than, say, our neighbors to the east.
Dr. Don Williamson says Alabama has more than 100 inflatable medical isolation tents called isopods, which allow doctors to reach through built-in gloves to work on patients isolated inside the tents. He says they are spread out, and every hospital throughout the state has access to one. Alabama does have quarantine powers and will use them if necessary to protect public health. But asymptomatic, low-risk travelers would be monitored on a case-by-case basis.
Is going to be a low risk or probably some risk patient who you ask them not to do certain things, and either you lose them because they aren't compliant in being in contact with you every day, or they go places where you ask them not to go, and then you have to make an assessment about whether or not what they've done is so serious that it puts other people's life and health at risk. And if you make that determination, that's when you use the quarantine.
The governor says Alabama is also keeping tabs on incinerated medical waste being transported through the state.
We escort that through the state, and we have already done that to make sure that everything goes well and there's no problems coming through the state.
Coming up at 6, we'll take a detailed look at the state's plan of action to combat Ebola if it does show up, and also how it would impact the state health system as a whole. Live in Montgomery, Mike McClanahan, WIAT 42 News, coverage you can count on.